Welcome to another proper form video, where we explore various exercises and techniques with an in-depth focus that are going to help you elevate your performance and optimize your workout, whilst also ensuring that you improve your posture and help prevent injuries in your future. So today we're going to be diving into one of the most important subjects we could discuss, which is proper breathing techniques whilst using your core. So for this video to be of the most benefit to you, I want you to make sure that you go back and you watch the proper form belly breathing 101 video and also the proper form core bracing video, and then return back to this one. Many people focus solely on core exercises to help strengthen their abdominal muscles, but they fail to understand or even see the importance of incorporating proper breathing techniques into their routines. As I mentioned in the core bracing video, I think a large part of that is because we've interchanged the word abs and core too easily, and we're confused by that at some points. And we now know that to use our core effectively, we need to be breathing. One of my main concerns when it comes to core activation and breathing is that if we are not activating our diaphragmatic breath whilst using our core, then it means that fundamentally things like our pelvic floor especially are not being utilised as well as they can be. Because the diaphragm and pelvic floor work in harmonious union with each other, we need to keep that going when we need all of those elements in our core technique. A lot of people can have hypertense abs, meaning that they're on all the time and they may look like they have a really strong core, but it's likely that the pelvic floor is dysfunctional and that the breath will be dysfunctional as well. And this is going to lead to injury, either in exercise or just through doing something simple in day-to-day life, because certain muscles are being way more used than others and some are being severely underused. This is what I call dysfunction when we have that balance. And when we have dysfunction, that's going to end up in something less desirable in your future, as well as just having that general kind of stiffness to your body, not making the progressions that you want, getting disheartened with your progress overall. And that's because so few people understand that the diaphragm is considered one of your core muscles and also one of your breathing muscles. So it is essential that it is used in both of these activities at the same time. And so first of all, I want to discuss some of the dangers that could be involved when you're not engaging your core correctly, aka not breathing through your abdominal exercises. Now, I did make that sound quite scary, but that's because I'm obsessed with anatomy, but there really can be some very real dangers to be had. First and foremost, if you're not using all of the elements of your core, so if you're not using all four sides, the top and the bottom, then you're going to be leaving yourself vulnerable to instability, which could create a scenario where you can get yourself injured, but also mean that you're not progressing as well as you should be. Some people can have overly tense abs and are also chest breathers, meaning that parts of the abdominals are fully switched on all the time. They look like they have a very strong core, but in actuality, there'll be some fundamental key issues in things like the pelvic floor and the diaphragm, and then in turn, maybe anxiety, depression, mental health disorders. Whatever the dysfunction is, it's likely to lead to something less than desired in your future. Things like lower back pain, problems with stiffness in the lower body like sciatic issues, as well as the lack of development and progress that I mentioned earlier. You're going to start to feel a little bit disheartened overall with your general progress. Maybe you're doing something like pole or aerial, where core functioning really can help you progress and move up through the levels. So checking on that proper form with both breathing and core, and then trying to form the ability of them working together, you're going to see such amazing results. You're going to start eradicating imbalances, you're going to rapidly improve your overall stability and strength, and then in turn make the improvements that you want to see, just simply based on the understanding of these two techniques. So how do we do it? How do we activate our core effectively and keep breathing? It's crucial to have both going at the same time, but it's going to take a little bit of practice. And you want to really be able to breathe as deeply and as fully as you can, whilst still maintaining all areas of the core being engaged. So you want to concentrate on breathing in through the nose, being aware of all of the different muscles in your body, including your pelvic floor, so that as you inhale and exhale, you have a sense of movement in the pelvic floor. And you want to start thinking less about it being called a belly breath, even though that is how I refer to it a lot. I want you for this moment to be thinking about your diaphragm. It is more than perfectly possible for you to engage your abs and still have the full use of your diaphragm in that breath. Now, like I said, usually I'm not a big fan of language of convenience, so it really is only belly breathing that I tend to stick to, but for this argument, I really want you thinking diaphragm so that you can engage the core, but still have plenty of room and functionality within the diaphragm itself. Try in a seated position or a supine position to start off with your belly breathing. Then layer in your core activation and check that you still have all points in place. Pelvic floor, back muscles, belly button, TVA, all of those are still switched on. And at the same time, you're able to inhale and exhale through your nose and feel your diaphragm moving. You may get a little bit more movement in your lower rib cage, and that's absolutely fine because we want that to help our diaphragm expand and contract. If you concentrate on the movement coming from your diaphragm rather than the abdominal wall when you take that breath, it's going to feel a little bit different. That's okay. It's going to be more focused into a better belly breathing technique eventually, and it's also going to ensure that you maintain the proper core stability that you need. Core bracing with correct belly breathing is definitely going to feel very different to when you are just belly breathing in a flexibility class and you're a little bit more relaxed, but that's okay. It doesn't mean that it's wrong. It's just going to feel maybe even more difficult than when we're trying to just focus on it on its own. It might seem slightly shallower because you've got more overall muscle engagement. It's something that's so much easier said than done, and it's best to master it in the simplest places first. So, as I said, lying down with those early stages of the abdominal exercises, and then layer it in to your more difficult, more complex exercises. So, can you do a fully core braced pull-up crunch on the pole while still breathing in and out through your nose and ensuring that the diaphragm is working? Regardless of what activity you're taking this into, I want you to really be aware of integrating your breath work with your core to help improve your overall proper form.